journey of life is different for all of us, but we all strive to find meaning and purpose for our daily lives, to live in the spirit of things as was intended for each other. Our stories of love and care focus on our holistic connections with our mind, body and spirit. Today we talk with Sue Murray, a health promotion leader who is perhaps doing the most important work of her life, building a restorative culture of care for suicidal behaviours in our healthcare systems. Sue was struck by how the health services with which she worked operated in an environment of retributive justice and was deeply concerned. That is, the suicide is dealt with in the context of compliance and consequence, a culture of blame and retribution. Think about it. Is the police turning up on someone's doorstep to do a welfare check the best use of resources and a kind and compassionate approach to extreme distress? What this says is that the systems in which our health professionals operate need significant change management. The current pressures they have been under during COVID are being well publicised, but the tail end of psychological distress experienced by the community will be long and arduous, and our health professionals will be expected to keep on keeping on. Whether the current blame culture is perception or reality, it must be eliminated. All health professionals deserve to operate in a safety-driven culture, focused on healing, recovery, and learning. I hope you enjoy the conversation today. Don't forget to subscribe to our channel, to like the video, and even leave us a comment. Well, welcome to another conversation. And today I have with me Sue Murray, who is the founder of the Zero Suicide Institute. Sue's going to chat to us a little bit about what she's been working on to address the scale and size of suicides in Australia and how we can best make it kinder, more compassionate, more health-focused. So welcome, Sue, but perhaps you could tell us a little bit about where this came from, because it's a big concept.
Yeah, so thanks, Kathy, very much. Look, the Zero Suicide Institute of Australasia really was born out of the global movement to focus the importance of the healthcare system as part of the broader suicide prevention framework. So the Zero Suicide framework was developed in the United States and really said, if people are presenting to our healthcare system, they should be getting the best available care that will enable them to focus on recovery. Now, in Australia, we have a system called Medicare. That means if you present to a healthcare system, we know who you are. Therefore, we should be able to ensure that you are received, managed, supported, and discharged into a supportive network of care. And that way, I believe that we can really make some significant inroads into reducing suicides within our communities, because although only 1 in 5 suicides may be people who have been in the healthcare system, they are the people that we know. And therefore, we should be doing everything possible to ensure that they are supported in times of vulnerability and also supported to a full road to recovery. And that's really what brought me to this particular framework. Having worked with Suicide Prevention Australia for a number of years, we were really focusing right across the spectrum of all of those important programs in the community at the individual family level to try and bring down the rates of suicide. What I saw in the healthcare system was a really laser-like focus where we could make a difference in a very short period of time. And that's what has really motivated me to try and advocate for the use of this framework within our healthcare systems.
So given the healthcare systems are so stretched at the moment, how is it being received? Are you getting to scale? Because, it's such, it's a new concept. And as we know, healthcare practitioners are often resistant to change in itself.
Well, we were very fortunate. The Gold Coast Mental Health Specialist Service, which was led at the time by Dr. Catherine Turner, is really held up as a global example of how this framework should be implemented and how important a restorative just culture is to the implementation of that framework. And what that was able to do was convince the Queensland government to look at the framework. That in turn escalated to New South Wales, to South Australia, and now, following the Royal Commission in Victoria, Safer Care Victoria is also going to be adopting the framework. So what it means is that when all of those states have this framework in place, and it's obviously at varying stages of development, but when that is in place, better than 80% of our population, if they were presenting to the hospital system, should be receiving that high quality care that comes with the Zero Suicide Healthcare Framework.
So currently, for those not using the framework, what happens in the healthcare system, just so people understand?
Yes. Well, I have to say, in the time that I've been working in suicide prevention, which now is just over a decade, there are way too many stories where people or families of those who've died have said that attending emergency departments is not the place for someone who is experiencing suicidal behaviours. And in fact, there are people who have attempted suicide who very clearly say they would not go back to emergency departments if they were feeling suicidal again. So we really do have a long way to go. Yes, the framework is being adopted in states, but the experience is very varied. And until there is, a clear pathway that all hospitals and healthcare systems have for identifying, engaging, treating, and transitioning people into and out of the system, we will still know that there are people who are going to fall through the cracks. So it's not the silver bullet that everybody hopes, but it is a way of ensuring that we can provide better care. And importantly, I mentioned that the Gold Coast used as a foundation a restorative, just and learning culture. That is a critical component for ensuring a psychologically safe workplace for the people who are caring for those who are suicidal. So under our current pressures that our healthcare system is experiencing, and there is no doubt that COVID has really interfered with the implementation, particularly in New South Wales, of the Zero Suicide Framework. But it is that restorative just culture that focuses on helping the healthcare worker make sure that they are safe, that they are not under undue stress, that their work demands are not so great that they are in fact not able to provide the care for people presenting with suicidal behaviour that they need. So it's there's a lot of factors within the system that are playing on the success of this framework at the moment.
So we have a situation where healthcare workers are ending their lives by suicide at really extraordinary numbers, and very concerning, with burnout and systems not supporting them. Are you getting, and many of them are frightened to come forward when they're vulnerable, which is one of the key issues. Are you getting feedback on that from, people like WorkSafe or others, of how this framework can even extend and support people in that manner?
Yes, so the underlying foundation of a restorative, just and learning culture that underpins the implementation of a zero framework. In South Australia, they have chosen to focus on that culture development first before they even begin to roll out, so that psychologically safe workplaces are in fact a reality for our healthcare workers. And then they will be in a better position to actually roll out the framework. I think the psychological safety of the healthcare workforce is really at a critical point in time at the moment, because of the pressures that are on the healthcare system as a result of the ever waxing and waning of COVID and the variations that have come to us from COVID. So we're trialling at the moment the rollout of an online program, which is then supported by a face-to-face workshop with Professor Sydney Decker, who is an internationally recognised expert in the field of safety culture. And he's worked within healthcare services where we have seen very significant differences for the workers as to how the workplace manages when there is an adverse event like a suicide within the healthcare system. At the moment, the experiences that we've been told about by healthcare workers when a suicide occurs of a person under their care, that experience is very, very damaging and causing many healthcare workers to leave the workforce. So we really do need to change that. And focusing around a restorative, just and learning culture enables us to understand who has been hurt, that is the individual, their families, the healthcare team, the organisation and its reputation. What are the needs of all those who've been hurt, and whose obligation is it to meet those needs? And those obligations come from many different parts of that system. And that's what the restorative just culture focuses on.
Okay. So how does this segue into welfare checks by the police? Because, my view, and having spoken to a lot of vulnerable people, it's very intimidating to have police turn up when you're probably at your most vulnerable ever.
Yes.
And feel wrong, just by the nature of the police presence.
Yes.
What's going on in that space?
Yes. So the Zero Suicide Healthcare Framework is really a series of 7 elements which, when implemented together, have been demonstrated to reduce suicides. But there is a continuum. People experience suicidal behaviour at home, in their workplaces, in the sort of general public, and at the moment, in many instances, the only place for them to go might be an emergency department. So there is a very strong movement to develop a continuum of care whereby there are safe spaces that people can identify and go to that are generally supported by a peer worker or peer workers that don't follow the medical model, which might be more of a requirement if you are needed to be admitted to hospital. But the safe spaces are about giving people somewhere to go where they know they will be met by someone who has been through the experiences that they've been through, and that can sit with them and listen with an open heart and an open mind. And very often, that is as much as a person needs to de-escalate that immediate crisis to a point where they can then be supported to go to other community-based services that may be able to assist them. So the safe havens and the new head to health centres that the federal government is opening go to the next stage where if a person does present and they are in need of psychological care, then there are healthcare workers attached to those head to health centres, as well as the peer workers who will be the first person they meet, but they are also able to speak with a healthcare professional in the head to health centres, should that be required. So I happen to be co-chair of the governance committee of the Penrith Head to Health Centre, and it has been co-designed with people from the community who have used community services and who it is a culturally safe environment for people to present to, and it has the healthcare professionals attached to it, and it has lounge areas so people can just come and sit and be there. It has little safety pods where you can just sit in a soft light with quiet music and just calm down. And so these centres are being opened up across the country now, and they're providing that alternative to emergency departments, and they're providing that staged care approach from the safe spaces or the safe havens as we have in New South Wales. So there is an effort to look at that systemic change, but of course you can't do that everywhere at once. And so the focus on bringing the zero framework into the healthcare system so that those who do present to the healthcare system are getting that compassionate, confident, competent care that is needed when someone is suicidal.
So the cost of this must be significant. What can the community do? I mean, government can only fund so much, and we know our system is under incredible stress for funding. Is this something that business could co-partner with in some way? You know, like the safe haven space, which sounds to me like a really significant thing that we can all be involved with.
Certainly. I mean, there is always room for extra resources. But one of the things about the zero framework, and again, I am coming back to the healthcare system, but the thing about the zero framework is that it is actually looking at reframing existing resources. So it's not about piling in new things that may make a difference. It is about using the expertise that is already in place and restructuring the work environment and the work practices so that people are getting the care that they need from people who are trained to be confident and competent and compassionate to work with people who are suicidal. The safe spaces, I would agree with you. Centres in the communities, locations in the communities, there could be a local cafe that identifies itself as a safe space, and that there are peer workers who are just able to sit and be with someone who presents to that local service. And I think Wesley Mission in Queensland, Nehemiah National across the country is looking at these models and how they can do them. Now they both, Wesley and Nehemiah, both charitable organisations that the community could contribute to make these spaces more accessible and more available.
What wonderful work you're doing, Sue. It's just amazing. Well done. So how are you funded? I mean, do hospitals subscribe to your service? Is that how it works?
So at the moment, the state governments are the ones who are picking up the actual implementation of the Zero Suicide Healthcare Framework. And myself and my faculty colleagues are then brought in as a support to the system. So we don't actually implement the framework. Our role is to really be that guiding expert advice that helps the system understand where are the strengths in our system, where are the gaps in our system, and can we use those strengths to fill those gaps, or what do we need to do in order to reduce the gaps in our system and strengthen it even more than we are at the moment? So, we work with the healthcare systems, and that's who bring the funding into the Zero Institute.
So last question, we've had a couple of really high-profile deaths by suicide recently, and what I'm noticing is the media getting involved, and perhaps too personally, rather than following the framework for giving out correct information. It's been really interesting because, it's very close to the bone, so to speak. Do you think there's a danger that we could not, just get to the community, I guess, is aware around mental health, and we could run away rather than come back to frameworks like your own that are the ones that are evidence-based and we're working to make sure they're implemented? I noticed it the other night on the news.
Look, I think the important thing, and Australia again is held up internationally for its reputation around responsible reporting in the media. And yes, there will be occasions when perhaps there is too close a personal connection and maybe the mind frame guidelines are not adhered to as well as we might like. But really, Mindframe has done an extraordinary job in educating the media and, the broader media in terms of script writing and film production about responsible reporting and responsible use of language in the media. So I do think that they're more the exception than the rule these days, where the media is not really focusing on responsible reporting.
Okay. Thanks for joining us, Sue.